Jason Collette, Contract Administrator here at SPEEA. I'm going to go over the 2018 Annual Open Enrollment presentation for your medical and dental plans. Boeing puts out a lot of great resources for you all regarding open enrollment to educate about the different plan options that you all have available. Use their information first. Look at our information. If you have questions, feel free to reach out to staff at benefits@speea.org. Again, we also will be mailing out the November Spotlight, 4 pages of very good information in there that you can use to go over all of the plan choices that you have, as well as frequently asked questions and some definitions of terms that you may or may not know, as well as some articles about what an HSA account is or health savings account. So take advantage of that. So in this presentation, we're going to go over dates and details, medical dental plan changes, voluntary benefit changes, disability changes, the flexible spending account, as well as the health risk assessment that you all are required to take this year. So open enrollment begins November 7th. It closes the 28th, so you need to have your choices made and selected by November 28th. You will get a letter in the mail, confirmation of election. You have 20 days from the date of that letter to correct any mistakes that were made. And all changes go into effect January 1st, 2018, and are in place until January 1st of 2019. And so you have until open enrollment next year to make other changes. Just some overviews. All the medical plans are changing. So a lot of you all haven't had to make any choices about your plans for a long time, as they've been locked in for many years. A lot of the plans are changing. The Advantage Plus plan has gotten significantly better. It's likely the best option for the vast majority of SPEEA members, as the deductible is lower and the HSA contribution from Boeing has gone up. So if you are HSA eligible, it's likely the best choice for many, many people. The overall plans are staying roughly the same. So it covers the same thing. The networks are the same. The vendors are all the same. All of that is the same. The differences that you are seeing are the highly visible differences: your premiums, your co-pays, co-insurances, deductibles, out-of-pocket maxes, things like that. That's what's changing. The only vendor, there is a vendor that's changing. The only vendor is mental health and substance abuse. It was formerly Beacon. It is now Blue Cross and Blue Shield of Illinois' network, which is actually larger. So 98% of the providers in Beacon are in the Blue Cross Blue Shield Mental Health Network. And so if you want to check with your provider to make sure there's continuity of care, but vast majority of you all should not see any changes there. Long-term disability is moving from SPEEA pays the premiums to Boeing pays the premiums. And so your benefit will now be taxed. It will go from 60% untaxed to 50% taxed. You still have the option for a 10% buy-up to get you back to the 60%. SPEEA members now have opportunity to be a part of the global health plan for visits for traveling abroad. That is a new thing, as well as now being required to take the health assessment to avoid a $20 non-compliance penalty for you and your covered spouse. The most visible changes that you will see to the health plans this year are the premiums. So the traditional plan has been free. It is now 5% of the cost of the plan. Select Network has been 12%. It will continue to be 12%. Kaiser is the HMO plan. It has been 12%. It will be 12% going forward. It's formerly known as Group Health. The Advantage Plus plan, which is what's known as a health savings account qualified high deductible healthcare plan, has gotten a lot better. So the contributions that Boeing will make into your HSA, if you're eligible, have gone up, and the deductibles have gone down to the lowest amount allowed by law. For the last many years, most SPEEA members have been in the traditional medical plan, or TMP. It made sense. It was an easy decision for a lot of folks, as it was the free plan. It was a great plan. But now that it's no longer free and other plans have been improved, it's no longer an obvious decision. And so we expect about 60% of you all to take to move into the Advantage Plus plan, as it is logically a plan that makes sense for a lot of folks when you factor in the amount of money Boeing is contributing to your HSA account and the premiums that are now charged for the other plans. Part of these changes is that you all now have to think about your health insurance. You haven't had to do it before. Again, vast majority of you just took the easy choice, the right choice, to take a traditional medical plan. This year, There's new terms that you need to know: deductibles, coinsurance, out-of-pocket maxes. Read the SPEEA Spotlight magazine that comes to your house. It goes over all of that. We'll walk through how some of the plan will apply and how those terms interact with each other. But first, the changes to the traditional plan. So this plan previously was free. It is now 5% of the cost of the plan. It used to have a sliding scale deductible. It's where the providers would know how much you made. So that's gone, which is good. Now your deductible is no more than $300 per person, no more than $900 per plan. Your out-of-pocket max is $2,000 for an individual and $4,500 for a family. That deductible is now included in your out-of-pocket max. It used to be an additional number. And the real difference in this plan is once you hit your deductible. Now when you hit your deductible, in 2017, you pay a copay. You go to the doctor, you give them $15, and that is how much they take, and you're good to go. Going forward, you won't pay at the time of service. You will receive a bill. And then that bill will say how much the plan kicked in. It will pay 90% of your bill, and you will pay 10%. So this is what 10% co-insurance. So on primary care, specialty care, emergency, hospital, in and outpatient, and tests, you will pay 10% of the cost of the plan. Your drugs are similarly cost as they are today. There's some further articulation around mail order, and then some new worst case scenario protections from Obamacare regulations. There's now an out-of-pocket max limit for pharmaceuticals at $4,000 for an individual and $8,000 for a family. Take note on the traditional is that the pharmaceutical out-of-pocket max is separate from your other medical expenses. On the other plans, they're lumped in together, but on the traditional, it is a separate byline, so you want to be cognizant of that. The Advantage Plus plan is the other plan that made big changes this year. It's gotten a lot better. So the big joke about this plan is that Boeing used to have to pay. It was so bad you had to be paid to get in it. Now Boeing's paying you a lot more money to be in the plan, so it might make sense for a lot more people. So the deductible has been lowered to the lowest allowed by law. This year it's $1,350 for an individual and $2,700 for a family. Your out-of-pocket max is 2 times your deductible for in-network, 3 times for out-of-network. Boeing will make a contribution to your health savings account if you are eligible. That is 75% of the deductible. So that's $1,013 for an individual and $2,025 for a family. So you get that money up front, the first paycheck in January. It goes into your HSA. It's income tax free. If you spend it on medical expenses, it's income tax free out. If you do not spend it, it grows like an IRA, income tax deferred. So this is what's called a triple incentivized account. You are only eligible to have this account if you're in a high deductible healthcare plan, which the Advantage Plus plan is the only one that you have access to. After you hit your deductible, the plan pays out just like traditional, 10% co-insurance for everything after. There's some differences on drug costs, or 10% for generic, 20% for brand name, and 30% for non-formulary. But that $5,400 family out-of-pocket max and $2,700 individual out-of-pocket max does include any pharmaceuticals that you have. So that is a thing to consider when you're making this choice. If you have expensive drug costs, factor that into how much you're likely to pay out of pocket. The Select Network and HMO plans, they were expensive yesterday, they're expensive tomorrow. You do have some new out-of-pocket maxes that were not in place before. $6,800 for an individual, $13,700 for a family. Co-pays have gone up, and you have some slight increases in drug costs. Really, this plan costs a lot of money due to the premiums. They're very high compared to the other 2 plans. Quickly going to walk through an in-network and an out-of-network billing situation that you could get into, and to show how the plan pays benefits through a situation like that. First, this example is an individual on the traditional plan for a $25,000 hospitalization. So they have a $25,000 charge from the hospital. Because they went to an in-network hospital, there was a negotiated discount of $10,000, which means there was an allowed amount of $15,000 for this hospital stay. The member paid $300 in their deductible, means there was $14,700 left times 10% co-insurance. They paid $1,470 for that, $1,470 plus their $300 deductible. For this $25,000 event, the member paid $1,770. The plan picked up $13,230, and then $10,000 was written off due to the negotiations between the health plan and the provider. Under a non-network hospitalization, that's the same cost, $25,000. There's been no negotiations between the plan and the provider because it is not in network. So the plan has allowed an amount of $13,000 for this event. So the member pays $300 out of that $13,000. That leaves $12,700 left. $12,700 times 40% now, because it is an out-of-network visit, times 40%. They will hit their out-of-pocket max, which in this case is $1,700 because they've already met their deductible. So that's $2,000 total that they've paid. That means the plan will pay an $11,000 out of that $12,700. And then because there is still $12,000 that was unaccounted for, it was never negotiated discount rate, the member is responsible for that additional $12,000. So for this non-network $25,000 event, the member pays $14,000. The $12,000 does not count towards the out-of-pocket max and essentially operates like a penalty for visiting out-of-network providers. So regardless of which plan you choose, either if you choose the Select Network, the Traditional, or the Advantage Plus, you have some other voluntary plans that you can take advantage of. One of them is Carina. It is a web-based portal for you to receive a doctor to check you out over the internet. So you call up the website, and a physician that's on the other line will examine you and provide care. That Carina can also do home visits, and so if you're in there's some density requirements. So if you're in Puget Sound, you can have a doctor come out to your house in an event that you're unable to get to a medical provider. There are some fees associated with that. The other advantage that you have, another account option that you guys have, is the Centers of Excellence. And so this is for big items: knees, backs, hearts, brains. If you have to have surgery that's going to put you on disability or leave for a significant amount of time, and these are complex surgeries, Boeing has determined that it makes sense for you to go to the best and get it done right and have the least complications, so that you're back at work and more efficient, and you have less expensive bills to them, so that you are back at it as quickly as possible. So on Total Access and on the Blue Cross website, there is a Centers of Excellence page, and it lists who the Centers of Excellence are for each procedure, where they are. If they are more than 75 miles from your house, there's travel assistance available. They'll pay for a flight for you and your spouse, as well as hotel rooms for you to stay during the time that you are away having surgery. It's paid 100%. There's no coinsurance. You do have to meet your Advantage Plus deductible before the plan will pay for anything. But if you're having a $100,000 surgery, you quickly can reach your deductible. Another thing that's available for SPEEA members that's new in 2018 is the Global Health Plan. So this is if you're abroad for more than 6 months or less than 2 years, Boeing will take you off of your Boeing Medical and put you on the Global Health Plan. Coverage while abroad is 100%. There's no coinsurance, you have no bills. This is for you and your family members. If your family or dependents are in the United States, they're using the Cigna network, and you will get a special card, just a new medical benefits card. If they're abroad, their coverage as well as yours is at 100%. When you come back into the States after your assignment is over, you come back onto your medical plan that you were on before. There's also a business travel plan for shorter trips. If you have questions about this, email globalhealthplan@boeing.com, or you can send benefits at SPEEA.org an email with your questions. If you'd like a summary of what's in your healthcare plan, you can go to bcbsil.com/Boeing. They have a lot of resources on there. This is where the Centers of Excellence page is. It will give you a summary of what the expenses are on your plan. So you go to the coverage and plans, medical benefits, actives and early, learn about the Traditional or the Advantage or the Select. You scroll down and find SPEEA Active. Click on that, and it will pull up a summary It will explain how much your premiums are, how much your deductibles are, what your out-of-pocket maxes are, how much your plan pays for certain activities. This is just a small summary, and so there are other places you can get more information through the bcbsil.com/Boeing website. So now when making the decision on which plan makes the most sense for you and your family, start with the premiums. So obviously there's premiums now for the traditional, it's $31.80 for an individual, times 2 for an employee or spouse, or times 3 for an employee, spouse, and children. So that's $31.80, $63.60, and $95.40 for a family. The Select Network is $80 for an individual, times 2 for a spouse, times 2 for your children, times 3 for your spouse and children. Kaiser is $85.61, times 2 for your spouse or child, times 3 for spouse and child. Note on the Advantage Plus plan, there is only 2 options, an individual or an individual plus. And so it's $84. This is a prorated amount that will come into your account. Again, you get it all in one lump sum, but this just shows that it is a positive amount of money that goes to you and what it is prorated. So it's 2 times as much if you're in the family plan as if you're an individual. So for the annual premiums, it's going to cost an individual about $380 in traditional, a family $1,100. It's $3,000 roughly for the Select Network and the Kaiser. For individual on the Advantage Plus, you get $1,000 if you're eligible for an HSA, or you get $2,000 into your HSA contribution if you are in the family plan. So that's quite a delta there. If you decide to choose one of the 3 self-funded plans, Select, Traditional, or the Traditional Select or the Advantage Plus, you get to make another choice. You can choose the standard network option, which is the same network that both the plans have today. Traditional and Advantage Plus have the same network. So if you choose the standard network option, you get the same choices that you had today. If you then, the other choice that you can make is the preferred partnership. So what this does is it voluntarily narrows your network from the worldwide Blue Cross Blue Shield network to the University of Washington Accountable Care Organization. So there's roughly 300 odd providers that you have narrowed your network to. So this preferred partnership is a great option for some people, but if it doesn't work for you, do not choose to do it. As we showed earlier, one out-of-network stay is going to erase any of the savings that you've made throughout the year on your premium contributions. You can visit SPEEAHealthPartnership.com to read up on who the providers are. You can check and see if your service providers are in that network. It does extend beyond just the University of Washington hospitals. There are other providers that are in that network. And so you go through these slides to look to find a provider. Here is a map of all of the providers in the state. There are roughly 200 primary care offices, 62 urgent care, and 21 hospital locations. As you can see, it's very sparse around Everett, much higher concentrations in Seattle and South. And so, again, if this is not a good fit for you, if you get your care from Swedish or Virginia Mason and have a specialist that you've been seeing for years, and you are unwilling to change to the University of Washington network, do not force it. Do not enroll in this. It will cost you a lot more money in the long run. When we signed this contract, there was a second option for a preferred partnership, which was Swedish. That contract was supposed to extend through the end of our contract, and for whatever reason this year that partnership was dissolved. And so it's unclear why that happened. There are some talks with the University of Washington is in to grow the network and have some presence up in Everett, but at this time, that may not happen. It may never happen, but right now that's where we stand. If you do decide that the University of Washington Preferred Partnership is a good option for you and your family, you do get something in exchange for dramatically reducing your in-network. If you're on the Select or the Traditional, you get $30, $60, or $90 off your monthly premium contributions. If you are in the Advantage Plus and have the HSA account, it will increase your contributions from 75% of your deductible to 100% of the deductible. So it really makes the plans much better. There is savings to be had, but it does come at a cost. So there's no University of Washington providers out of state. So if you're traveling and you have an issue, you will likely be out of state when you receive care. There are some enhancements and some metrics that improve. If you call for an appointment by noon, you will be guaranteed an appointment the next day. There's more coordinated care for those of you with complicated medical conditions, with the specialists that are talking to each other. It's much better for that, but again, it comes at a cost. So as you can see, your premiums will be reduced fairly dramatically. It's $21 a year for an individual on the traditional, $43 for employee and spouse, or an employee and their children, and $64 for family. The premiums are still very expensive on Select Network, and your HSA contributions go up fairly significantly on the Advantage Plus plan if you do sign up for the preferred partnership. Again, and you want to consider that if you have a child that is university out of state or on the other side of the mountains at Washington State or Gonzaga, this might not be a good fit for you. All right, so there's no changes to the dental plan. You still have three options: Delta Dental of Washington Preferred Network Dental, the Scheduled Dental, and the Prepaid Dental. The vast majority of SPEEA members are in the Preferred Network Dental. It makes sense. It's the best benefit for our members. It pays the highest rates to the providers, and they're prevented from balanced billing. So if the charge rate is higher than the allowed amount, the provider cannot bill the member for that difference. You can go to deltadental.com, deltadentalwashington.com/Boeing to find a provider. The vast majority of dentists in Washington are in that network. So you should be able to find a dentist in your area that is covered under that plan. The scheduled dental plan is a relic of a different time, and as such, the reimbursement rates have not increased since the 90s. The annual maximum benefit is $2,000, and so you get money from the plan for the procedures that you have. You go to a provider, they provide care, and they bill you, and the amount that you have gotten from the plan is far under what you will be charged. So you will be paying a lot out of pocket. There is no network, but again, it's not necessarily a good plan as it hasn't been updated in 20 years. The prepaid dental plan is the plan that we receive the vast majority of our complaints about, more than the other two plans combined. You have to pick a provider, whether you go to them or not, and then they will receive monthly contributions from the plan, whether or not you receive care. So if you go to schedule an appointment, they have no incentive to schedule you because they're already getting paid. This may make sense for some people who have never had dental coverage and have a lot of work that needs to get done in a back order, as well as a flexible schedule since there's no incentive for the dentist to schedule you. After you get the work done, then it would make sense to switch over to another plan. But this could make sense for a few of our membership. Disabilities changed. Those of you who remember, SPEEA took it over to pay their own premiums from Boeing to get a higher benefit. The problem was that if you didn't enroll when you were hired, you had to show evidence of insurability in order to receive long-term disability insurance. Many of our members are unable to show that they are insurable, and therefore they are left without long-term disability care. Between a third and a fourth of the SPEEA membership does not have long-term disability insurance. Beginning in 2018, Boeing will pay the premium, so everyone will be included into the plan and will have coverage at 50% taxed of their current salary when they go on disability. There's an option to buy an additional 10%. If you do not have disability insurance today, you will need to show evidence of insurability to get it. If you have it today, Boeing has told us that they will proactively check the box for you, so you have selected it as a default, but it is up to you to ensure that you do have disability insurance when you get your confirmation of election. There is a 1-year look back or a 12-month look back for folks, for new entrants into the long-term disability. So they will look back to see if there was an issue that would have denied you the ability to be insurable. So in 2018, that is an issue that goes back 3 months. And so after that, going forward, all folks will have insurance. Again, if you have long-term disability today, you will want to make sure that that box is checked so you get your 10%. If you do not have it today, you can check the box for a 10% buyout, but you will need to show evidence of insurability. SPEEA members still have access to a flexible spending account. The rules are the same today as they are in 2018. If you can, you make tax-free contributions into your flexible spending account that can be used for qualified medical expenses. If your allocation is available immediately, you need to lock it in at the beginning of the year, and then it's taken out of your check throughout the course of the year. Any money that you do not spend under $500 can be rolled over. Any amount over $500 that you do not spend is lost. So it is different than your HSA or health savings account in that way. Additionally, it's available to anyone regardless of which plan they're in. If you're enrolled in a high deductible healthcare plan and have an HSA, there are special rules for your flexible spending account. You'll be put in what's called a limited flexible spending account before you meet your health plan's deductible for the Advantage Plus. Your limited healthcare FSA can be used to reimburse only a limited number of expenses. Dental, vision, and certain preventative procedures can be used. After you meet your deductible, your limited health plan FSA can be used to reimburse most, but not all, of the eligible expenses in IRS Publication 502. Per the contract, SPEEA members are now required to take a health risk assessment questionnaire in order to avoid a non-compliance penalty. That is required for SPEEA members and any covered spouses. This is the health risk questionnaire that's available through WebMD. If you take that questionnaire, you will be redirected to a WebMD portal to take this questionnaire. Your spouse will need to create a login if they are covered, and they will take it as well. If you do not take it, it will be a $20 per person per month penalty. Dependents do not need to take the assessment, and you are not required to take the health screenings. You do not need to go to a Boeing nurse to have your blood drawn and have those numbers submitted to Boeing in order to avoid this non-compliance penalty, but you do need to take the health risk questionnaire. Again, the deadline is November 28th as well. If you have questions or issues with the health assessment, reach out to benefits@SPEEA.org in order to get any questions answered. And if you have any other questions about the plans, feel free to reach out to us there as well. You can go to the SPEEA.org website. On the top, there is a lunchtime meeting schedule. Click on that. It will show any lunchtime meetings for the coming month that are in your area. Keep an eye out for the spotlight, as there is a lot of information there this month to help you make the correct choice for you and your family. If you have other questions, you can reach out to staff. You can contact benefits@SPEEA.org, or you can talk to your council reps for any other questions.